Good morning. My name is Michał Kołak and I represent Archimedis. I come from both the IT and the health sectors. So I worked with the IT technologies for a long time, and then I became a part of P1 project. I will speak about the project which started during this forum some time ago. I met someone 2 years ago at the forum, and we found out that we have a very similar approach to the possibility of introducing electronic medical registers. So I would like to speak to you about the solutions proposed by Archimedis, and we would like to offer these services to healthcare facilities, hospitals, clinics, but also producers of medical devices. Would you be so kind as to help me to change the slides? Thank you. Thank you for the hint. I will do it myself from now on. So, we wanted to face up to the challenges of the electronic medical documentation. We have a very positive example of e-prescriptions introduced this year. They made it possible to reduce the number of patients visiting the clinics just to have the prescriptions refilled or reissued. As regards the creation of medical registers, often a time hospitals or clinics are required to create such records, and diagnostic laboratories are such an example. And sometimes they lack competencies to create medical registers and medical documentation that would be compliant with the legal requirements, HL7CDA formats. And then, when it comes to the maintenance and updating of electronic, but also paper records, we need to keep these records sometimes for as long as 30 years. And we have to make sure that it is stored safely. There are dangers of floods if our archives are located in basements. Sometimes your servers can burn down. Sometimes your servers are located somewhere that is accessible by others, even though in order to do that you may have to force the door. And sometimes medical companies, clinics or hospitals do not have or do not create backup of their medical records. So sometimes it is also simply a waste of space, because you have to pay for this space and you're not really using it efficiently. You have no access to this space because this is where you store your medical register or medical documentation. And when it comes to making the medical records available and the exchange of data, soon enough we will be required to make our medical records available to other medical services and other facilities and entities. This will mean that you would have to connect both in legal, organizational, but also practical sense with other entities. This will be complicated. We would need to integrate the systems, decide on the format for data exchange. It is also possible that this documentation will have to be made available 24 hours a day, 7 days a week. We're not sure whether that will be the requirement, but it will be. There will be a requirement to make these available. And now for e-referrals. We are not quite sure how this will work, but some of these e-referrals will be accepted and forwarded by the current system. However, there are other referrals, for example, those which are not reimbursed by the National Health Fund. And then documents will have to be made available to the patients free of charge at their request. Actually, such a requirement is already in force as of last year. There will also be a requirement to make such information documents available to another healthcare entity. This will be required as of July next year. So how would we like to support you in responding to these challenges of medical records and making them available? As regards a very generation of an electronic medical record and medical documentation, at your request, we can generate such a document. All you will be required to do is to sign a document, and we will ensure that this document is always compliant with the law, provided there are amendments introduced to a regulation by the Minister of Health, or if Polish legislative framework changes, our documents will be adapted accordingly. So you, as medical professionals and medical facilities, will no longer be required to know all the profiles, all the requirements, all the formats for that are compliant with the national or international standards. And if you are a software company, you may lack some competencies, and in such case, we can support you with our expertise. Our services will ensure compliance and integration of your systems with the legislation in force. And as regards the storage of paper and electronic medical documentation registers, we can offer a safe repository which is located at a reputable storage facility, an exchange facility. So your data, your documents will be safe, and it will also enable you to exchange the information and the documents as will be required by law. We can also make sure that your paper registers, your paper archives become digital in a way that is compliant with the law. And then we can also make sure that the paper documents, once they have been made digital, are safely shredded and disposed of. And when it comes to both the electronic and paper documentation, we can offer a central repository and the point where exchange of data will take place. There, we will offer connections for different types of software and different medical entities, be it hospitals or clinics. We will also be connected to other repositories. There are medical networks, there are companies that already have such repositories, such archives, and we do not want to interfere with their current software, but we want to make sure that we have an interface where we can cooperate, we can exchange information. So the services that we offer can be divided into services that ensure compliance with the current legal requirements published by the Parliament or the Ministry of Health, or the services that can be offered on a voluntary basis that are not a legal obligation but can improve your management of medical registers or documentation. As we have said, it is not our ambition to replace the current archives or repositories of either electronic or paper documents. We want to connect to the existing solutions and systems. We are open for cooperation. We are open towards offers, and we can extend our project. We can offer cooperation as part of our Archimedis project, but we can also work with outside partners. Our offer is addressed to medical facilities. If you are a small hospital or clinic, if you do not have your own archives or repository, if you are very anxious about the upcoming requirement to make your data available, to offer exchange of documentation, we can help you. Thanks to our assistance, you will not be required to connect with all other healthcare service providers. You will just have to be connected to us, and then we can make sure that the exchange of electronic medical documentation will be possible as of the 1st July next year. And that will be a legal requirement from then on. You can contact me, my colleague, or also other members of Archimedis. Some of them are taking part in the eHealth Forum. They will have to disclose their participation in the project soon enough. This will no longer be a secret, so you will have more and more opportunities to learn about our services, and I'd like to encourage you to get in touch with us, and I would like to wish you a very fruitful discussion.